Functional Physio presents ePoster 2020. Associated by Mind Academy and Sportson.
Presenter Anchita Priya. Untitled Evaluation of Physiotherapy and its integration with other forms of physical therapy.
Hello everyone. Warm greetings to organizing committee and all the students of Physio committee. This is Anchita Priya from BPT second year. Before I proceed to my presentation, I would like to thank all the organizers for this wonderful opportunities. So today my topic for presentation is evaluation of physiotherapy and its integration with other forms of physical therapy. Physical therapy as a profession has its roots to earliest of time, when the techniques were used for treatment much earlier than that of origin of the very term physiotherapy itself. The growing evidence in terms of increasing randomized controlled trials in physical therapy indicated development of quality clinical practice guidelines to translate evidence into practice. Professionalizations in physical therapy needs a shift towards professionalism to move physical therapy forward in all three core areas of the professions. Now, evaluation of physiotherapy. Physiotherapy or physical therapy or PT is a conservative science of the treatment and management after the clinical examination, assessment and diagnosis of the disease for restoration of neuromusculoskeletal and cardiopulmonary efficiencies, managing pain and certain integumentary disorders with the help of physical means like radiation, heat, cold, exercise, current, wave, manipulation, and etc. The earliest documented origins of actual physiotherapy as a professional group date back to Per Henrik Ling, father of Swedish gymnastics, who founded the Royal Central Institute of Gymnastics (RCIG) in 1813 for massage, manipulation, and exercise. Physiotherapy is a science-based healthcare profession that promotes recovery in illness, injury, or disability. Physicians like Hippocrates and later Gallienus are believed to have been the first practitioners of physiotherapy, advocating massage, manual therapy techniques, and hydrotherapy to treat people in 460 BC. After the development of orthopedics in the 18th century, machines like gymnasticon were developed to treat gut and similar diseases by systematic exercise of the joints, similar to later development in physiotherapy. In 1887, physical therapists were given official registration by Sweden's National Board of Health and Welfare. In 1894, 4 nurses in Great Britain formed the Chartered Society of Physiotherapy. The first physiotherapy research was published in the United States in March 1921 in the PT Review. In the same year, Mary Macmillan organized the Physical Therapy Association, now called the American Physical Therapy Association or APTA. Now, the integration of physiotherapy with other forms of physical therapy. In primary healthcare or PHC, physiotherapists can assume several roles. They can work one-on-one with patients with musculoskeletal and neurological conditions, provide fall prevention training, and educate patients and caregivers about preventing and managing chronic disease. In Ontario, recent policy changes have expanded the role of physiotherapists in PHC and increased the extent of their integration into PHC organizations across the province. There are many types of physical therapy treatments like manual therapy, exercise, hot and cold therapy, traction, laser therapy, and etc. In addition, physiotherapists in PHC team also play an important role in group-based programs which focus on preventing and managing chronic conditions and on promoting health and wellness within the community. Despite the broad potential impact of integrating these physiotherapist roles into PHC, to our knowledge, little has been published on the factors influencing the integrations of physiotherapists into PHC team from the physiotherapist perspective. Physiotherapists work across the healthcare system, including in hospitals, schools, private clinics, home care, long-term care facilities, and PHC organizations. Benefits of incorporating physiotherapists into PHC organization, including enhanced chronic disease management, decreased wait time for consulting a physiotherapist, fewer inappropriate referrals to specialists, decreased unnecessary diagnostic testing, increased patient satisfaction, cost effectiveness, and increased quality of life for patient. Previous studies in PHC indicated that physician and nurse practitioners valued the integration of physiotherapists into their team and that PT was the most requested rehabilitation service. Physiotherapy is not only an effective form of treatment for pain management but also aids in the treatment of a variety of conditions including musculoskeletal dysfunction such as rotator cuff tears and joint disorders, neurological conditions such as stroke, spinal cord injuries, MS and Parkinson's, repetitive use injuries such as carpal tunnel syndrome, and sport related injuries such as dislocations and concussions. Physiotherapy is an effective form of treatment for the reduction of back, shoulder, and neck pain in the body and directs you towards a pain-free lifestyle. Physiotherapy focuses on sustainability, not only dedicated repairing damage but also teaching how to avoid future injuries and discomfort. Now, what is the difference between physical therapy and physiotherapy? They are exactly the same. There is in fact no difference between the two terms and each term can be used interchangeably. They are synonyms. Some practitioners suggest that physiotherapy is more concerned with manual therapy. Now, how has the technology affected physical therapy? With the ability to access care on demand, patients are more likely to see a doctor when they need to, and there's a higher likelihood that patients will complete their treatment plans. Physical therapy through telemedicine can help reduce a lot of these fears and encourage patients to complete their exercises. 3 ways technology has improved physical therapy treatment are physical rehabilitation, virtual reality, and telemedicine. The most common challenges faced by physical therapists today are stress, patient obesity, healthcare legislation, keeping fit, and etc. Now, what are the benefits of physical therapy? The benefits of physical therapy are reduce or eliminate pain, improve mobility, recover from a stroke, improve your balance and prevent falls, manage age-related issues, and etc. The main types of physiotherapy are sports physical therapy, orthopedic physiotherapy, pediatric physical therapy, and many more. There are more than 200 physical therapy programs accredited by the Commission on Accreditation in Physical Therapy Education or CAPTE in 2015 alone. So coming to the conclusion of this presentation, the integration process is affected by factors ranging from individual to system level. The integration of physiotherapists into PHC would be enhanced by a greater understanding of the role of physiotherapy in PHC by physiotherapists, other healthcare professionals, and system planners. I thank everyone for listening to my presentation. I hope it was informative. Thank you.